Governor Kathy Hochul recently signed legislation to address healthcare disparities among the LGBTQ community. Today, our New York Capitol correspondent Elise Klein hears from healthcare experts and advocates about the impact.
Last week, Governor Kathy Hochul signed a legislative package that would allow homeless and runaway youth under the age of 18 to make their own healthcare decisions and to require specialized gender identity training for nurses and home healthcare aides. Yarrow Brown, an advocate and member of the LGBTQ community, underwent two major surgical procedures in 2018. They wrote on the patient instructions to be called by their preferred pronouns they, them, but the healthcare providers taking care of them at the time did not get their pronouns correct, Brown says. For them, this legislation is personal.
They are starting to open up the realization that they also have to realize that people like me exist.
Other advocates say this legislation serves as, quote, a ray of sunshine for members of the LGBTQ community.
I think this signals a bit of hope. And I also think, or I hope, that it is showing the LGBTQ New Yorkers that our legislation is listening to us.
Laura Eric, Vice President of Public Policy for the New York State Association of Healthcare Providers, says the specialized education proposed in this legislation will be in addition to the programs offered through the State Department of Education. Eric adds that while this legislation will have a positive influence on the healthcare community, it could be financially very difficult to implement.
I think the concern amongst home care providers is that training is not currently reimbursed.
Eric says the cost will depend on how the legislation is implemented, but state funding or developing a reimbursement process could go a long way. In Albany, Elise Klein, WNY News Now.